好，大家好，各位观众大家好，今天是2月1号星期一，我们为大家现场带来这个 COVID-19 的解说。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, February the 1st. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Just to give you a sense of this week, Tuesday, Wednesday, and Thursday, you'll get written briefings with updates on COVID case counts and other relevant information with respect to the pandemic at around 3 o'clock. On Friday morning, Dr. Henry and I will be briefing on the latest modeling and the state of the pandemic. On that day, which is February 5th, is also the day when the current orders expire.
那么而且现在的卫生禁令正好礼拜五结束，那么会给大家说或者延长，或者是怎么样。
It's my honor to introduce Dr.
那么现在请 Henry 来。
Thank you and good afternoon. Today being Monday, we're reporting on 3 periods of time between Friday and Saturday, January 22nd to 23rd. We had 408 new people test positive for COVID-19. Between Saturday and Sunday, the 23rd to the 24th, there were 473 new cases positive for COVID-19, and in the last 24 hours, 277 new cases were diagnosed. That leaves us with 1,158 people diagnosed with COVID-19 over the past weekend, 4 of whom were epidemiologically linked, bringing our total number of people who have been diagnosed with COVID-19 to 67,937 people in British Columbia. Of the new cases, 295 people live in the Vancouver Coastal Health Region, 493 people are in the Fraser Health Region, 78 people were here on Vancouver Island, 194 people were in the Interior Health Region, and 98 people live in the Northern Health Region. We now have 4,134 active cases around the province, 289 of whom are in hospital, 79 in critical care or ICU. An additional 7,242 people are under active public health monitoring, and 61,117 people have recovered. Over this past weekend, we've had an additional 21 people who have died from COVID-19 here in British Columbia, bringing the total number of people in British Columbia who have died to 1,210 people. And as always, we know how challenging a time this is to have somebody who's passed away from COVID-19 in particular, and we want to send our condolences and thoughts to the families, the caregivers in our communities who've lost our elders and seniors for the most part across the province. We have one new healthcare outbreak at the West Side Care Residences group home, and outbreaks have now been declared over at one of the Burnaby Hospital sites and at Brookside Lodge long-term care. This leaves us with 24 active outbreaks in long-term care or assisted living, 8 in acute care units, involving 801 residents and 430 staff. As you know, we are starting this month of February with a limited vaccine supply, but we hope and we've been told that we'll be increasing our available supply as the month progresses. Importantly, while fewer people are receiving doses this week, we are continuing with our preparations to have widespread immunizations underway on a bigger scale than we've ever done before across the province. In a few short weeks, we do expect that we will receive additional Moderna vaccine later in this week, although it's slotted for coming the week of February 1st. We understand the vaccine will take some
礼拜。
Probably until Friday of this week.
那么可能礼拜五会来莫德纳的。
expecting a small amount of the Pfizer vaccine
可能量不多。那么辉瑞呢也会量少一点会来。
We have immunized 138,892
people
with a single dose, and 4,491 of them have received a second dose.
那么4499个呢已经第二针了。
Really important part of our program, making sure that we are
那么这个也是我们疫苗计划的一部分主要是对长期护理院以及这个医疗诊所的防护。
I want to talk a little bit today about
那么今天呢会对这个病毒变异大家关心的再多说几句话。
To date, we have had 18 cases confirmed
of a variant
of concern. 4 of these confirmed cases were the B1.351, which is the variant that was initially identified in South Africa. 3 of these cases were unlinked community cases,
其中3例是相互之间没关联的，也没有旅行史，没有接触史。
We now are up to 14.
另外呢，有14例呢，确诊的呢是英国的 B117，南非的是 B113，那么这些呢都是有关联的。这个里面包括了7例是新增的，这个周末是新增的7例是英国变异，这个也是告诉大家有一个概念。我们现在的南非病毒已经在社区里边。
3 in Fraser Health and
3个在菲沙，3个在沿岸，1个在菲沙卫生局。
We are actively trying
我们
to
已经
determine where
找到了主动的确诊了这些病例。
acquired their infections. Of the 14
那么14例的英国变异的确诊病例呢，都是在岛上的，都是一个从英国回来的，然后另外3个都是密切接触。
One in Vancouver Coastal and one in Interior
一个在沿岸，一个在内陆，都是英国回来的，一共3例英国回来的。那么这个3例呢就传了14例，另外11个所以它这个是英国的变种呢是很清楚的，这个线路图是很清楚的。
So we have been working with our colleagues across the country,
所以我们也全国的同事们都紧密的合作。
Network here in BC to have 3 different ways that we're
我们现在有不同的方法都是在找病毒。那么现在就是第一个就是采样的病毒，我们在随机的抽样做这个基因变序的。所以上个礼拜我们已经做了一些随机抽样看到了包括医院里边或是省波医院我们看到那边有爆发的倾向，所以我们就看那些在这个社区里边的样品材做测试，包括对所有的从国际上回来的旅行全部做了抽样。那么我们也是有目标的选取了这些采样。
And we're, for example, doing whole genome sequencing of all cases in young people and school-age children.
对年纪轻的人和学龄的年轻的人全部做了基因测序。
a little over 11,000 whole genome sequences.
那么现在意思就是说，超过了11000例的样本去测有没有基因英国的这个变异。
We have the ability to do about 500 whole genome sequences a day. But that is, we're looking at measures to increase that and to do.
那么我们现在每天呢有500多个在做，每天做500多个基因测序的样例。那么我们现在也要增强这个基因测序的数量。
To be one that is carrying one of the variants of concern. So those we expect to be able to step up our surveillance.
所以我们也要加强监控。这些在接下来的几个礼拜里边，监控英国的变种。
Of a confirmed case is attended a school in the Fraser Health region.
那么今天呢，在菲沙卫生局下有一个孩子在这个在格拉迪在伯勒比的他是去过，他是确认了，但是他也去过学校了那么我们现在对这个英国变异的这个病毒的特性还不完全了解所以我们现在还是要对紧密的与菲沙卫生局都紧密的合作。
person in the school.
那么对这个学校里边扣号的那些孩子都是紧密他们一共有80个连接都已经做快速测试那么都是在现场就能测试知道结果。
Because we know that the rapid test can miss
PCR
positive cases that are asymptomatic in particular. So that is undergoing today over the next few days and will give us a better understanding if there's any ongoing risk from this potential transmission event. So this is one of the things that is most concerning for us right now that we've seen in other parts of the world and here in Canada. Reports on the weekend from colleagues in Ontario in particular have shown that we are seeing some transmission in communities at this variant, and there's been a number of outbreaks in long-term care homes in Ontario that have been associated particularly with the UK, the B117 variant. So we have stepped up our surveillance, we are monitoring and testing in outbreaks particularly, and we'll present more data about how we're doing that surveillance later this week on Friday morning as well. But just to know that this is one of the things that is factoring into all of the decisions that we have to make together over this next coming weeks. We have vaccine, but it's coming in small amounts, and we've been in a little bit of a pause because of vaccine supply. There are other vaccines that are currently being evaluated by Health Canada, and we're hopeful that many of them may become available for use in the coming weeks. But right now, it's important for us to maintain our precautions that we have in place so that we're not transmitting widely in our communities until we can get a better sense of where these variants are, how they're spreading, and protect each other from them. This also reminds us that gatherings of any size in our homes
这个提醒我们这个不管你人员多人员少，尽量避免聚集，尽量的这个都风险很高我们过去的几个礼拜看到了年轻人的，特别是学龄的儿童他们的阳性率已经往下走了。这个因为这个是我们重点保护的对象。那么我们现在看到19岁到41岁的这个年龄阶段的人开始上升了他们获得阳性的病例上升了这个主要是跟工作场所相关以及这个社交暴露有关包括了接下来呢有一个我们 BC 省家庭日以及一个中国的春节，所以希望大家能够还是要遵守这个行李让我们安全的度过进入3月份。这个我们的家庭朋友聚会还是希望这个春节希望这个12月份的节日一样，我们对酒吧什么都会有限制希望大家能够安全的度过这些节日。我知道BC 省的绝大多数的人都很遵守我们知道已经显示了他们的能力，也知道了他们如何在做安全的做。那么现在这个过去的一个周末，我们的 WorkSafe BC 以及沿岸卫生局都是在加强这个卫生的在工作场所的卫生条例以及这个检疫。因为在过去的几个礼拜看到了工作场所的都传播，然后过去呢周末呢他们又到这个 Whistler 的那些滑雪的地方去加强卫生检疫的工作。那么我也听到了一些很多的这个案例都是
coming together in a restaurant that might have the seating and might have the spacing and might have everything done right.
大家都计划得很好有这个空间有这个不同的，但是呢就是到了之后呢就很困难去那个维持这些卫生禁令，所以呢病毒就很容易传播，特别是在 Whistler 这些地方。 那么礼拜五呢，这个我们现在的禁令就要结束。那么我会礼拜五给大家有一个更新，到底是放松还是紧张，或者是那么这个礼拜又有一个美国的超级碗比赛，希望大家还是在家里不要到餐厅，不要到酒吧。因为我们没办法控制自己的话我们没办法你再控制这个病毒，所以你只能是待在家里。希望大家能够往回走，也希望如果你一定要去，那么相互尊重我们的每个人的安全，尊重我们的酒吧、餐厅的职员包括这个零售场所的这个安全。包括工作场所的安全。这个也是我们每一个人BC省人我们一定要考虑到这个每一个新的来周、新的月希望我们能够往前走，我们都有机会能够继续。我也打破这个病毒的传播的链。希望我们也是能够只是在本地做一些必要的采购每一个本地的都是。然后戴口罩这些都是攸关的，每一个都是重要的这里边的 matters， 这里就像到黑命贵的那个 matters 一样的，就是你做这个事情是重要的希望大家还是待在本地如果还有聚集的话人少一点在接下来几个礼拜、几个月里边，还是要这么做，让我们安全的度过进入这个春天希望大家也是 be kind。Be safe, be calm 也是这样。那么卫生厅长照例说一下过去死亡的21个人那个然后呢
Thank you very much, Dr. Henry. First of all, just
诚挚的哀悼。那么我会把过去3天的数字给大家重复一下他也是说了21个人给是死亡的21个人的家庭朋友给到于这个过去的3天里面死亡致以诚挚的哀悼那么3天伯尼森是日期报错了，但是天数没报错，周五到周六是408，周六到周日是473，周日到周一是277，3天是1158。
Particularly for those who are most vulnerable, it is profoundly unfair to people. We want to know to all the families how much they're in our thoughts today. Just a couple of small things just on the dates of the weekend. Yeah, we were just talking about this that the weekend obviously was January 30th, 31st, and February 1st. And I think there was just
那么2月2号、2月3号礼拜1、礼拜2呢，礼拜3都是书面通知他说一下。那么卫生厅长也是对刚才的伯尼森的口误做了一些。那么现在是一共是138000多个人已经打了第1针。那么4492呢人呢去打了第2针了90说错了。那么礼拜1呢也会给大家汇报一下我们省的个人防护服以及这个医疗储备的物资的这个情况。
30,670 N95 or equivalent respirators. An extraordinary 30,030,700 surgical and procedure masks, 221,722 pieces of eye protection, 16,427,975 pairs of gloves, and 1,636,310 gowns.
包括了消毒液有多少万
positive news in long-term care and assisted living. And independent living. As you know, on January 15th, we had 49 outbreaks in those 3 types of facilities, and that number, as Dr. Henry has just reported, is now 24, which is a significant reduction. And
对这个老人院、长期护理院的，本来这个同期是49个1个月前呢，现在这24个了爆发，那么明显的减少，所以这个也是看来上次伯尼森说了，也是归功于疫苗的功劳。他们也比较谦虚的确，因为你所有的措施都上去了，但是这个老人院的爆发还在增长，所以这个就是很大的问题了。那么这个1个多月老人院的这个疫苗打下来之后呢，现在这个爆发的数量明显降低1半了，所以这个也是说了归功于疫苗。
As you know, and as I've just noted, there are fewer outbreaks than there were 2 years ago, but there are still 24 outbreaks in assisted living and in long-term care, which is still a significant number.
这个还是数量不小，所以这个也对大家也是挑战和困难。特别是这些老年人，包括职员很多职员也生病。
in a profound way quality of life. So I want to announce today that the Ministry of Health has engaged the Red Cross to provide response teams consisting of non-clinical and administrative staff to select long-term care and assisted living facilities. Priority sites are identified initially by Fraser Health and Vancouver Coastal Health. We'll see their efforts bolstered by Red Cross provision of non-clinical support services. It'll work this way. A Red Cross assessment team visits and performs an epidemic prevention and control assessment to identify areas of need and to familiarize Red Cross staff with the facility. The assessment teams work with health authorities to identify supports required and understand infection control, prevention and control work already underway. And teams of support aides are assigned to the facility. Typical deployment of the site includes a team of about 20 individuals, 2 teams of 10 to cover 7-day-a-week services for a maximum 4 weeks per site. We are currently identifying a small and important program up to 5 priority sites in Fraser Health and Vancouver Coastal Health. It should be remembered that the protection afforded by vaccination, while important and while demonstrating its worth at the present, isn't immediate. It takes about 2 weeks for the first shot to reach full effectiveness. And that's 2 weeks when we need to be especially vigilant. And of course, everybody who's received their first shot will need to receive their second shot. The addition of the Red Cross to support efforts at this time is appropriate and significant, and it's intended really to support the quality of life in long-term care. It's an important step in our ongoing pandemic response, and I thank and recognize the Health Employers Association of BC, the Hospital Employers Union, Employees Union, the BC Nurses Union, the Health Sciences Association, the BC Government Employees Union for their efforts to ensure that we can deploy the Red Cross teams immediately and, as I say, to 5 care homes. In closing, we're obviously at a particular moment in the pandemic, and it's a serious one for everyone to consider. We obviously feel good about the amount of vaccine we've received so far. Our only wish is that we would have more sooner, but we are working hard to prepare for that. The anticipation of what this might mean for all of us later in the year is there. But at this moment, even in this weekend, we are averaging just under 400 cases a day, and sadly, 7 people a day passed away. This is a moment when we have to continue to take actions to act to stop the spread. It determines in no small way, in every important way, what our pandemic will look like in the near future. This is a very important moment when we ask everybody. Like Henry talked about Super Bowl Sunday, really all of the events that are before us, the Lunar New Year events, other events around Family Day, and the events in the coming weeks that we have to really right now support and follow public health guidance and public health orders. It is critically important, and particularly when people are out where they can be, that they respect
所以，如果大家就算出家门了，也是希望你们尊重其他的人。尊重我们所有的人。现在我们正好是时候拉低曲线，来减少病毒传播的最关键的时刻。这个是太重要了。
Last Friday and several times before that, our expectation right now is to be able to vaccinate about 10% of people by March 31st. Indeed, as of June 30th, on our present plan, on our present, what we're told by the federal government, that number will be less than 50%. That means that we have to continue to
所
follow
以
the
按照我们
guidance
的
and
疫
the
苗计
advice
划，就
for
算
the
到6月
foreseeable
30号，
future.
我们
And I
BC 省
strongly
也就
encourage
50%
everyone
不
to
到
do
的
so.
人才能打上疫苗， 所以这个更加提醒我们，疫苗就算现在来了，但是到6月30号，我们 BC 省的一半的人还没打完啊，所以这个一定要大家不要放松，不要放松啊，这个就算你外出也要尊重大家，也要尊重。所谓尊重，也就是要安全卫生这个。
Et nous offrons nos condoléances aux familles et aux amis des 1210 personnes décédées du Covid-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence, nous avons eu 408 nouveaux cas. Pour la deuxième période de référence, nous avons eu 473 nouveaux cas. Au cours des dernières 24 heures, 277 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de Covid-19, 289 personnes sont actuellement hospitalisées, dont 79 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everyone on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. I would also ask that you please unmute your phones. You are not audible until your name is called. First question today is from Richard Zisman, Global News.
Dr. Henry, how large is the concern that there has been spread of the variant in the school setting? And with
那么这位 Richard 的记者问了啊，就是你对学校开始传播英国变种病毒，你是怎么顾虑的？你焦虑到什么程度？
Around first overall testing and masks as well.
Yeah, so we have been, as you know, doing surveillance for these variants of concern for some time, and we've been targeting school-age children, and so far none of the tests on anybody who's in the school system have turned up positive. So the initiative we're doing today at the Garibaldi School was because one person who was in the school did have a positive COVID test and was a contact of somebody who had a variant. So there we're obviously going back and testing them as well, but we want to make sure that there's no other spread in the school, so that's the reason we're doing this. And as we learned in the use of the rapid tests in the correctional facilities, for example, they are helpful in giving us a sense of what's going on, but they're not accurate enough on their own. So we're doing both testing with the rapid test and the PCR test.
PCR 可能就是核酸检测，两种都在做，
都在一个
所以他说这个用一个快速检测呢快一点，但是还要结合核酸检测。
very uncommon in our
这个
schools, and we'll
不是很正常的这个传播，
with the school
所以我们现
communities.
在也跟学校局紧密合作。我也说过了好几次，我的一个同事葛嘎医生以及 Richard 就是在确保学校的安全环境都是符合我们的卫生条例，所以我们现在也是要求在学校里边使用戴口罩这个是很重要的。
Thankfully, right now, in small numbers, but this is a period of time where we're still trying to figure out what it means and how it's spreading across Canada and across BC.
Do you have a follow-up, Richard? Are you there, Richard?
I am. I mean,
go ahead.
I'm sure you've heard, Dr. Henry, that there were some charges laid over the weekend under the Health Act in connection with downtown parties that we've spoken about here before. Do you think the operator being arrested and charged is enough of a deterrent, or do you think he should go to prison if the allegations are true?
Yeah, so it's not my job to mete out the punishment for these types of offenses. I do think it was offensive that was happening, and I am appreciative that the police took the action they did. I think all of us are doing our best to follow the rules, and we understand why. And when people are flagrantly violating those rules, then that's why we have the orders in place. That action can be taken, but that that is up to the judicial system to make a determination about what should happen with that person. But I think we all need to understand that the little bits that we do are important, and we know that for the most part people are doing the right things.
Next question is from Chad Clausen, CFJC.
Hey, Dr. Henry, thanks for taking my call. I know the focus here today is on exposure in school, and I'll get to that in a little bit. I did want to shift gears a little bit to ask a sports-related question. As you probably know, last week the Western Hockey League was approved, received approval in Alberta to start play later this month. The league is proposing a hub model here in BC. Sounds like Kamloops and Kelowna. Weekly testing is going to happen. What's the latest on that, and what is it going to take for the government basically to approve the start of play here?
Yeah, so as you know, we have restrictions on sports around, particularly allowing youth and young people to have some activities. We are in ongoing discussions with Via Sport, which is the provincial organization that oversees a lot of these guidance. And yes, we are talking about what is rational given our epidemiology and what's happening around the province. I have not seen that particular plan that you referenced, but we have been in discussions with the Western Hockey League about potential for a season at some point in the future when the epidemiology allows it.
整个这个季节赛季如何弄也是主要是只要是流行病学方面能够允许了，那么我们就会。
Cases, 4 exposures, including apparently community transmission within the school here in the last couple of weeks.
那么这位记者肯定是 Kamloops 来的，因为说到了 Kamloops 学校这个卫生场、运动场以及这个学校里边的这个 exposure 暴露的情况，那么到哪一个程度你要考虑关闭这些学校
？And I know we haven't had a lot of exposures outside the Lower Mainland.
他说在低陆平原其实有很多学校都有很多的暴露情况。
reflects what's happening in communities, and we've started to see increased transmission in communities in the interior, in the north, and even here on the island more recently. So yes, we do see exposure events with very little transmission in the school, and the local MHO works with the school to make sure we know who is in contact with who, and we have a definition of a cluster, so a small amount of transmission within a cohort or an outbreak, where we have more widespread transmission between cohorts, and we've had a few outbreaks around the province. But right now, it's between the local MHO, the school MHO, working with the school community to assess the risk for each particular school. So in some cases, when several cohorts have had to go home or to be isolated because of risk of transmission, or when a number of staff have been affected, educators in the school system, that the school doesn't have enough people to run safely. Those are instances where schools have closed, sometimes on the advice of the MHO and sometimes on the school's and superintendent's advice, depending on being able to function safely. So there's a number of factors that go into it, but clearly every time there's an exposure event, we need to work through what was being done, were the precautions being followed, who's at risk, and that is what local public health does with each and every school.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, this question is for Minister Dix. It's in relation to the allegations that you were asked about on Friday in relation to the pregnant mother in Kitimat. And Mary Ellen Turpel-Lafond has sort of weighed in, and I'm wondering what the progress is on the task force that resulted after her report. Has that task force been set up, and have those Indigenous liaison positions been implemented in the health authorities?
Thank you very much, and first of all, welcome, Katie, to your new position and here in Victoria. And you'll expect, I think, this week, the release from Dr. Turpel-Lafond, the full data report, and I'll be providing an update on those questions at that time. I think the progress has been really good. As you know, We have a new Associate Deputy Minister of Health, Don Thomas, who's Vice President of Vancouver Island Health Authority, who's come in and taken leadership of the provincial government part of those initiatives. We have all of the health authorities fully engaged, and the First Nations Health Authority and the First Nations Health Council playing a crucial role in all that. So there's significant progress, and I'll be reporting this week in some detail on that. And so I think in the next couple of days you'll get answers to those questions and quite a few more.
Do you have a follow-up, Katie?
Yes, I do. So can you say specifically if those Indigenous liaison positions have been created? Because again, that's the family is saying that the Kitimat General Hospital should have an Indigenous liaison person because they're concerned both about the pre-care and the aftercare for this particular mother.
I agree, and I think we are proceeding with hiring of 32 liaison positions, 5 in each health authority and 2 in Providence Healthcare, so that's 32. And I'll be giving you a specific update on that, but I strongly believe that adding those liaison positions, including all, in addition to other work being done, will greatly strengthen the response of health authorities to addressing and developing anti-racism as a guiding principle in those health authorities. So I think those positions are important. And as I say, this week you'll expect an update on all of the issues related and all of the follow-up and all of the actions that have been taken since the report was put into place. I had the opportunity to report on many of those at the national conference that was done on anti-Indigenous racism in healthcare led by the federal government this past Thursday, and I'll be reporting in detail on that. As Dr. Turpin-Lafont reports, I think really the extraordinary, very challenging data that has been developed through her comprehensive report on racism against Indigenous people in our healthcare system. So we'll have the details on that soon in terms of who's been hired, what the process is, but the expectation, we're proceeding and created and funded 32 places, and we'll have more information for you later this week.
Marcella Bernardo, News 1130.
大家可以记得吧？问来问去就这几个记者。
I just wanted to ask you about some Whistler hotels are now.
那么这个记者问的是威斯勒宾馆那些现在的这些问题。
What is allowed when you've repeatedly told everyone that we need to stay close to home?
那么现在是有点让人家觉得模糊了。一会儿不鼓励大家去，一会儿那边又开所以他说这对这个宾馆业来讲是太困难了还有对特别是旅游业、宾馆业我们也是跟这些行业呢不断的在联系接触，包括了餐厅业联合会等等。
Quite a few times, actually. My office
可能
meets
好几次
regularly
了
with
他
them
说
as
好几
well.
次了跟他们有谈判
these are
有交流
questions that we will bring to them. As you know, we have been discouraging, particularly out of province, and absolutely out of country travel right now has been too risky. As well, we're asking people to stay local and to go to their local ski hills, stay in their local communities. That's really important to support your local community and the businesses in those communities. So it is not something that I would support at this point. Advertising
不支持这些国际来旅行的来这个旅游的他们打广告这个不要再打广告了，我不支持了。那么他说也是关于这个冰球联盟的事情了WHO。
And time is running out for them to apply for scholarships or a chance to buy for contracts at higher levels. So what's being done to get them back on the ice again?
Yeah, and as I said, we know that physical activity is important for the mental health and emotional health of children as well. Not to say that music and arts is not important, because we know that is important as well. But much of that can be done remotely. And we have been working with Via Sport to look at how we can make sports more available, especially to our children and youth. But I would just say as well that this is not unique to BC.
这个不是我们 BC 省单独的这个是全球都是这样的，不是说就我们 BC 省对这个体育严格严令这个全球都这样的特别是学校大学运动等等所以这个是很特殊的一年，对每一个人来讲都是我知道这个有些很多禁令都颁布了，所以我们也希望大家能够越安全越好。
experiences for young people in particular.
特别是年轻人，特别来讲还是要适应，对他们来讲也是一个重要的经历。
Hi there. Dr. Henry, you said a couple of minutes ago not to make Super Bowl plans. Does that mean that?
那么他说几分钟前你也鼓励大家不要做这个超级碗的旅行计划。
Are some type of restrictions?
那么会有没有这些
so those are discussions that we're
我们现在也在讨论有没有那些禁令。我说的这个旅行计划就是指大家都要到酒吧去餐厅去去看这个超级碗。那么我们现在的所有的禁令，大家如果都能完全遵照的话这个都没问题。所以这个是两方面的。如果我知道我们的口讯信息都被每一个人都遵守的，那么包括酒吧包括餐厅都落实到位，那么这个我们的卫生官员环境官员都看到了，那么也是希望这个执法机构能够加强，但是不一定是全在我们身上也要看到每一个人都是自己要担起这个责任来。
If we want to be able to safely
不要把这个餐厅
these moments to enjoy, then we need to do them differently this year, and we all have to take responsibility.
enjoy 去影响别人去把风险带给他们
right now where we have been able to keep these
这个是每
businesses
个人的
open,
责
but
任
it's
了
because we have these safety plans in place.
所以我
And
们
when
也
we
希望
start
能
to
够
flaunt
餐厅
those,
本
that's
地
when
的
we're
餐饮
seeing
业能
transmission
够安全
happen
的
both
开出
to
来
staff and between people in those environments. So we've seen some of the enforcement that happened this weekend.
所以我们会这个礼拜已经看到了大家都看到了执法机构在严厉执法。
Do it with your household. Do it in a way that doesn't
所以这个礼拜呢，希望大家还是在家里吧，在家里看这个超级碗。大家家里不用再出去了，不要再增加风险了。那么卫生厅长再强调一下。
This is the year to watch it with the people living in your household, to watch the Super Bowl game with people living in your household and only those people. Those environments are the wrong environments right now. Occasionally in the past I've attended Super Bowl parties, Grey Cup parties, and they're events that are almost designed for the spread of COVID-19 and the various things that occurred at them. In your home this year, it's only people in your household. I understand your question was about restaurants, but in your home, no Super Bowl.
这个文化还是不一样我们就是愿意待在家里他们洋人喜欢社交。
Sorry.
The Stanley Cup Finals, which are going to be in July, we'll be in a different place in July.
他说那个7月份Stanley 杯是7月份那么这个会不一样
I'm an NFL fan, so Dr. Henry, I also want to ask you, I mean, you're kind of hinting at where we're headed with these restrictions. And, I don't expect you to tell me today, what the decision will be Friday. But
他说你今天其实给大家一些暗示了，但是我不愿意听到你礼拜五说这个禁令在延长。
Allegedly, all I want to do is gather with one friend in my backyard, 6 feet away for 20 minutes. How worried are you if these restrictions continue too long that people will not listen?
他说你对如果你的禁令在延长大家又不听你你会更加的顾虑这些事情。
Sure. Sit outside with a friend for
他说当然了你在外面和朋友坐一坐短时间里边这个还是风险小主要是室内的不同的人在长期的交流接触我们看到太多的事例就是这样传播的特别是年纪轻的人有些人都是小规模的社交的但是这个就传播我今天 或和这个朋友吃饭明天呢又和另外2个人出去吃饭
today and then a different group tomorrow.
明天呢是不一样的人
That's our nature,
这个都是我们每个人的共性年纪轻的人都是这样想
that period of time where we want to go out and make connections with people.
就想大家相互联系起来
self-restraint right now.
但是我们还是要
to do that again.
还是要
But right
大家
now
能
we're
够
seeing
限
that
制
that's how
自
this
己
virus is getting transmitted, and
我
we
们都
don't yet
看到
have
了
enough
这个
people
病毒就是这么
protected
传的
that we aren't going to get
我
spillover
们不希望
into
看
people
到
who
这
are
个
going to
病
end up
毒
in
在
hospital and people
看
who
到
are
了
going
我们
to
受关
unfortunately
照的人受保
have
护的
serious
人
illness from
结果
COVID. So
置于风险之
we
中
have to
我们不愿
be
意
able
看到
to
这个
keep to our
医
small
院的
group,
资
find
源又
ways
被
of
击垮
connecting with each other and supporting each other to
我
do
希望
this
大
right
家
now,
相互支持
to get
相
us
互
to the
联系
period where
用
we
一
have
种
enough
新的
vaccine
方
that we
式
can protect enough
那
people.
么现在我们
And
的疫苗
it's,
又没有足够
it's not
保护每一
people,
个人
maybe I'll just leave it at that. I understand how hard it
那么
is,
他说我换
particularly
种
for
方法
young
说
people
我
at
也
this
理
point
解
in time.
对你
But
们
we
来
also
讲现
know
在
that
太
young
困
people
难了
care about their communities
这
and
个
they care
你们
about
不
their
让你们出
families and
去
they care
但是
about
希望你们还是
doing
要
their piece.
关心我们的家庭
So
关心
I
我们的
know
社区
that
关心
when
你所爱的
we say
人
this, people know what to do now. And
你
yes,
要关心
it is
他们你关心
challenging.
他们的话
We
你就
have
不
this
愿意再出
concerning
去了
variant
我们
that
现在
is
又看到了很多
causing
的
havoc in
病
other
毒的变
countries,
异
and we
在
don't
我
want
们
that
国
to
家已
happen
经
here.
像幽灵一样在传了这个是你一定要看清楚你要看清楚
Hi, thank you. Dr. Henry, I don't know, 18 cases of the with the variant of concern isn't a huge
那么这位女记者问的就是18例变异的情况
younger cohort involved, if the symptoms are in any
或者
way
是年纪
more
轻的
serious
这
for
些
younger
孩子
people.
cohort
I'm just
的
wondering
去
if you
传
know
染
anything
呢
about
他们的
can
症
talk
状
about
是什么样
how this might
你能不能说一
change
下
our
这
path
个
in terms of
能是
the
什么
pandemic
如何改变的我们这个全球流行病的
I'm
走
hoping
向
it doesn't,
我们也
but
不希望这个
we do know that it is a younger group of people. We know that it is younger people that are traveling. So when I say younger, I mean people in their 30s, 40s. So
他说
between
我说的
19
年
and
纪轻的人
50,
是
for the most
30岁
part,
40岁的人
there is
不是指那些
one younger person, a
那么这
teenager.
个主要还是19岁到50岁之
These
间
are
有一
people for
个
the
10几
most
岁的
part who
孩
have
子
traveled internationally and come
他
back.
是从国际旅行回来的
Except the 3 cases that we know of with the South African variant.
那么还有
So
3例是南非
it
病
is
毒
very
根
much
本
travel
没有
related.
旅
We're
行
not
关
seeing
系
a lot of it
没
in
有
our
关联
community
他们
despite
就
the
是在社区
surveillance
里
that
面
we're doing around
跟没旅行没有关系
different outbreaks, etc. And the random sampling that we're
所
doing
以
on
我
a
们现
routine
在也是在
basis.
随机的在
But it
做
is a
基因测
concern
序
because
做
every
采样
time this is introduced and it can spread, we can see in other countries how it has
我
started
们也
to
在其
spread
他国
rapidly.
家看到了只要有一例病毒
that
传了
is
然后马上就
what
会
we're
快速
worried
的
about
传播
right now.
马上快速的就传播出去了我们都看到
It's
了这
hard
个
to
路
know
径
what's going to happen
所
in
以
the
现
next little
在
while.
我们也不知道
Follow up,
BC 省
Justine?
很难预测
We've
BC
all
省
given
今
up
后
on trying
怎么
to
走势
guess at the future, I know, but you mentioned 3 different types of surveillance that you're doing. I'm
那
wondering
么
what
他
is
说
the
你是
total
提到了3种这
amount
个
of
监测的方式
testing of this type that we're
那
doing
么
on a
这种
daily
是一种
basis,
快速
and how
测试加
urgent
上
is it,
基
do
因
you
测试
feel to increase that capacity
那
for
么是不是
surveillance?
我们还是
Yeah,
要
so
加
I
强这
mentioned
个
we've done
监
about
控的能力
11,000. So it's the whole genome sequencing that allows us to pick up these specific
我
different
们目前为止已经
strains or
做了
variants of the
11000
virus.
例的这个
And
基因
the
测
whole
序
genome sequencing, we
来
can
看
do
这
about
个
500
不
to
同的病
600 a
毒
day.
那
And
么
we're trying to ramp
那
that
么我
up
们
to
现在其实一天的容量是
700
500到
to
600
1,000
的
a
基因
day
测
if we
序
can. As you know,
我们
we've
可能
had
到
about
700
500
例
cases a day, so that
如果
doesn't
我们
allow
要
us
需要
to
的
do
话我们可
all
以
of
到
them.
700例一
And
天
it takes the process is a little bit slower, so it takes
那么
several
因为
days
这
to
个基因
do the
测
whole
序的
genome
时间要
sequencing.
3天到4天
So we
所
have
以
been
这个还是
doing,
要
as
没
I
有那么
mentioned,
快
3 things. One of them is routine surveillance, so
那么
randomly
这里边是一
samples,
个是常规
particularly in
的就
areas
是
where
随
we
机
have
的
higher case
采样
loads. We've been doing specific outbreaks and
那么
areas
第二
where
个
we're
呢就是
seeing
对
rapid
这个
increase
爆
in
发的地
cases,
方重
and
点
we're
检
doing
测
all of the people who test positive after travel. So
我们已
the
经看到了
priorities
很
change a
多
little
旅
bit
行回来
depending
的
on
人
what's
都是
going
阳
on
性
last week we were over the last 2 weeks we were very concerned about the rapid spread in a couple of hospitals. So we made sure that some of the tests from those hospitals were checked to make sure that it wasn't a variant causing that rapid spread. The other one that we're watching very carefully is people who test positive after vaccination, and now that many people are 2 weeks at least past their first dose, making sure that we're not seeing any variants that would affect our immunization program. So far we haven't, but those are targeted things too. So the BC CDC lab is coming up with a strategy. They're working as well with our counterparts across the country to come up with a national strategy for screening to try and leverage all of the resources that we have, including the National Micro Laboratory in Winnipeg, laboratories in Quebec, Ontario, Alberta, to do whole genome sequencing as well.
Next question is from Shannon Waters, BC Today.
所以我们本省的基因测序还是要在其他地方做的。
Shannon, are you there? Okay, we're going to move on to Zara Premji, CBC.
Hi there. This is for Dr. Henry and Minister Dick. So some BC cancer patients who must travel to the U.S. regularly for their treatments are saying they should be granted quarantine exemptions like truck drivers because their travel is essentially the new measures forcing people to quarantine at the traveler's expense rather is particularly burdensome to them. So would BC support travel exemptions for people seeking medical treatment in the U.S.?
So that's a bit of a challenging thing, and we've worked with the federal government who has jurisdiction, of course, on international travel. So we do know as well that people who are traveling for that type of treatment are going into a medical center, which is a higher risk environment in the U.S. So there is some need for them to isolate so that they're not exposing others around them, both when they're in the U.S. and when they come back. And we've been working with our federal counterparts about how they can best support people, but it's a very difficult question, and it is a national, both the Canadian Border Services Agency and the Public Health Agency of Canada have jurisdiction over that type of travel. I think there's also a role for testing that can support people who need to go back and forth for treatments, for example.
Sarah, do you have a follow-up?
Yes, and you mentioned this topic earlier, of course, but regarding the possible exposure to one of the variants at a high school in Maple Ridge, do you plan to add more protocols to schools like rapid testing or mandatory mask policy within the classroom? If not, why not? And can we also get that in French?
So I think if you look at the safety plans for schools, masks are one part of it, and there are many different parts that reduce the risk of transmission and reduce the risk of widespread transmission in schools. And so masks absolutely are part of that. And as I mentioned, Dr. Gustafson has been working with the school team to look at where things are working and where things aren't working, and there'll be more information about that later this week. But masks have always been a part of one of, but not the only safety factor in schools. In terms of testing, today will give us a good example. We do testing of people who have symptoms in schools, in the school setting, and we make sure that children with specific symptoms have testing, but also the adults in the school system need to be tested if they have any symptoms at all. Whether rapid testing in schools is of value is something that people have been looking at across the country. It certainly makes a difference when you don't have to use a nasopharyngeal swab. Although I will say that the nasal swabs that have recently been approved by Health Canada finally are not yet available here, but we'll be looking for those as well. And of course, we can't use the spit and gargle test with the rapid test. So it's a little bit of a dilemma, but we also know that the rates of of COVID in school-age children are very low,
那么我们也知道，就是这个学校里边的这个比率啊，还是很低很低的。
An environment that would be where rapid testing would be the first choice in terms of
所以快速的测试也是不是我们这个是很有用的，但不是我们第一个想到的去用的这个方法。因为这个棉花签啊什么也不是很容易得到的。那么我们现在的这个日常的测试一直在做我们也是在监测有没有潜在的暴露的风险，然后呢用法语。那么不是所有的观众一开始就打开我们的直播，我再把过去的3天的数字给大家报一报。周5到周6是408例。周六到周日是473例，周日到周一277例。但我打声招呼，按照我个人的经验来讲，周日到周一一般都少，可能这个时间点的截取不一样。所以3天呢是1158例。当然了，现在都低于500了，这个也是一个好事情。那其中呢，这个沿岸卫生局呢是295，3天新增；飞沙3天新增493。岛上卫生局3天新增78，北部卫生局新增，内陆卫生局新增3天是194，北部新增98例。那么现在呢，有289个人住院，但是重症监护多了79例那么过去的3天里边有21个死亡。那么现在 BC 省的新冠相关的死亡是1210个人，很遗憾。到目前为止，我们省有138000多个人接受了第1剂的疫苗，4490个人接受了第2剂的疫苗那么目前为止呢，现在活跃的案子记录在案的是4134例基本的情况就给大家汇报到这儿。那么这个法语也回答也是最后一个问题。
mené par le docteur Gustafson. Et il y aura plus à dire, je pense, dans les jours et semaines à venir, parce qu'il faut continuer à travailler là-dessus d'ici jusqu'à la fin de l'année scolaire.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Laura Kane, Canadian Press.
Yes, thank you for taking my question. I wanted to know more about the Red Cross going into care homes. So
那么他是问的是红十字会对我们这个care home 那么你请称一下有多少人到是20个人还是总数，还是你能够确认一下因为我知道这个是100人的总共有100人的你现在是看了这个是数字问题，你请你再澄清一下人数问题。
necessary now?
Well, it's something that we've been pursuing. As you know, we worked with the Canadian Red Cross last year during the pandemic when we were developing and expanding and looking to expand acute care space. And so this opportunity became available. We talked to the Red Cross. We asked them if they can provide these supports, and we've come to an agreement with them to do that. It's only, as you say, in up to 5 care homes. So the idea is approximately 100 people. And the idea really is to support the activities of the care home, particularly in care homes that have gone through either very challenging outbreaks or are currently going through outbreaks. All of the people involved, and it'll be, I think, just under 100 people will be immunized. We go to 5 sites, and it gives us the ability to simply support the people living at those sites, because the kinds of services, non-clinical services that can be provided make life and will make life better. And so this is something we wanted to pursue, and we've come to an agreement. We're announcing it today. And even though the number of outbreaks has declined, this is a very challenging time in long-term care. I think it in some respects it always is, but particularly in those facilities that are still undergoing outbreaks and challenges. So I think it's important to continue to do what we're doing, which is hire staff, support care homes, improve infection controls, and in this case, add additional supplementary support from the Red Cross. I think it makes a lot of sense, and the fact that there are fewer outbreaks now than there were 2 weeks ago is not a reason not to support those going through outbreaks and care homes that maybe have just been through an outbreak but are facing and are dealing with the challenges and genuine exhaustion that comes with that. But mostly it's about improving the quality of life of people living in those care homes during a very difficult time, and I think it's a good idea. Thank you.
Oh, Laura gets one follow-up. Laura, go ahead.
Thank you. So also for Dr. Henry, you said last week that all residents of long-term care homes and assisted living have received their first dose of vaccine. But we heard from a family member of 2 residents at Crofton Manor in Vancouver who said his parents haven't received their first dose. So that's an assisted living facility. So is it true that all residents have received their first dose at assisted living facilities? Can you just explain why that's the case that for this couple anyway, they have not received their vaccine yet?
Yeah, so there's a couple of things. We said that public health has been, or the immunization teams have been into all long-term care and registered assisted living that we know about. There are some that may not be part of the system, and there's some that are independent living that are not. Sometimes it's a challenge to know the difference between the two, but not everybody received the vaccine. There are some people, whether they didn't have consent or didn't have the ability to give consent, or people who were recently infected, and in some care homes that was a fair number of people, but we have very high rates of immunization in care homes, and there is turnover in care homes, both in staff and of course in residents. So people who missed the first offering of the first dose in care homes will be caught up as the health authorities go back into each of the homes. For the second dose, and for some people that'll be their first dose. We're doing our best to try and catch people before they are admitted to long-term care, whether it come from hospital or from the community. But there has been people who come and gone in the time period where between the clinics or between the vaccine offerings in the long-term care. Sorry, I'm stumbling over my words today. So most people have been done. All of the homes that we know about have been visited, and people, the health authorities will be following up to catch up people who are missed.
为什么？因为这个疫苗的包装啊，它特殊，它打开了必须打掉。那么现在就存在这个问题，这也为什么莫德纳的疫苗给北部和内陆去打，而辉瑞的都是在大温地区打。因为辉瑞的打开一盘就900多针，必须要按时6小时里边打掉啊。那么今天的这个现场解说就到这儿，我再给大家报一下：3天新增408、773、277啊，从1个多月了，第一次看到。好了，各位观众啊，今天的新冠疫情新闻简报 BC 省的就为大家直播到这儿。感谢您的收看，也祝大家一周